what is critical thinking? Critical thinking involves the application of knowledge and experience to identify patients' problem and to direct clinical judgment and actions that result in positive patient outcome. What do you mean, Professor? What NCSBN and NCLEX is really interested is that you show them that you have the ability to be a safe nurse and that you have the ability to see a clinical scenario and really understand what is going on, and most important, how can you react in a safe way. When it comes to medication administration, what if you have an emergency, you have a medical emergency, and you have to act fast? Well, what medication are you going to give that patient? Why? Are you going to be taking or doing an assessment prior to administering the medication, or are you just going to go straight and administer the medication? And you see, these are questions that is not as easy to reply and say, well, Professor, I will do this or that, because it really depends on the scenario. So one of the things that I do on every single question, every time I have the opportunity to practice an NCLEX style question with you, what I do a step-by-step analysis first on the question and then the answers. And I use what is called the process of elimination. You have to understand how to do that. If you're not doing this every day, you're making a mistake. Why are you making a mistake? Because critical thinking is not something you develop overnight. So there are different medications that you need to know, and each one of these medications affect the body and organs in different ways. There are some medications that you really need to learn which laboratory values pertain to those medications. There are some medications that before you administer, you have to monitor lab values. There are some medications that before you administer, you have to see how the vital signs are. Medications such as calcium channel blockers, beta blockers, you have to monitor blood pressure. Medications such as nitroglycerin, you have to monitor that blood pressure because it can affect the patient's blood pressure. And everything that I'm telling you is included in NCLEX style question. So you have to develop that ability. For example, when they're telling you that a patient has a problem in the pancreas, then you have to know, well, what is the relationship between pancreas and my question? I'm giving this medication, but what is the relationship with a patient with a pancreatic problem? What is the nursing intervention that is important in order to show the NCLEX that I am a safe nurse? And this is the key. This is the most important thing when it comes to critical thinking. But why is critical thinking so important? Because if you do not prove to the NCLEX that you have the ability to think critically, you will not pass the NCLEX. You will get a fail. You will go to the NCLEX over and over, and the ultimate result will be fail. I don't want that for any one of you. I want you to succeed in your NCLEX preparation. This is why I created this free YouTube channel. As you start thinking critically, there is something called inductive reasoning. Inductive reasoning, it is an ability that each one of us have naturally, but you can develop it even better or more in depth. Professor, give me an example of what inductive reasoning is and how does that apply to critical thinking. Let's look at this question here. A 35 5-year-old client arrives to the emergency department with excruciating chest pain and diaphoresis. So there are several keywords that are important here. The patient's age or the client's age, 35 years old. So we're dealing with a young adult. He comes to the emergency department and complains or reports chest pain and diaphoresis. But there is an adjective that describes the type of pain or the severity of the pain. It says excruciating chest pain. So this word here, excruciating chest pain, is extremely important. What is the priority nursing action? So this keyword tells me that this question is a priority. When I show this scenario to you, what do you think is going on? By doing so, you are applying what is called inductive reasoning. Basically means that you are using the clinical manifestations described in this scenario and you are applying it to clinical manifestations in patients that are seen in a condition that you are aware. But before you know that condition, you need to have knowledge. So if you've never read about a myocardial infarction and the clinical manifestation of myocardial infarction, you will not be able to use inductive reasoning. This is why it is together. It is critical thinking and nursing content or nursing knowledge. So as you review this question, you go, oh, this is a myocardial infarction. And that is great. Great job. Now you know what is the problem. But that is not it. Now, the NCLEX is going to provide you several answers. Some answers could be implementation. Some answers could be assessment. Some answers could be medication administration. Some answers could be call doctors, call the cardiologist, call the healthcare provider. Maybe other answers uses the delegation guidelines. So they're going to give you a mixture of answers that only understanding that this is a myocardial infarction scenario is not enough. Because what are you going to do if they tell you, what's your first answer? Call the doctor, give oxygen, give nitroglycerin, do an EKG. It gets pretty challenging. It gets pretty difficult. So inductive reasoning, it is the beginning. But you need to have a prioritization critical thinking strategy. You need to follow a step-by-step system. And you have to recognize if your first answer or if your priority answer is a nursing implementation or an assessment. So a lot of scenarios on the NCLEX deals with this. What is going to be your first nursing action? Are you going to jump into the scenario and start teaching, and start giving medications, and start calling healthcare providers, or are you going to do an assessment first or something that is called validation? Sometimes you need to validate before you give a medication. And you have to say, well, how do I know when I have to validate before I give a medication? Let's begin with what is validation. Validation is a component of critical thinking. So validation means doing an assessment, doing another assessment. But when you're validating, what you're doing is verifying data, verifying information. So when they give you a scenario, usually, okay, we're going to talk about some general guidelines, because if I focus on the exception of the rule, you're never going to learn the concept. So what is the general guideline? The general guideline is, if you're dealing with a scenario, a pharmacology scenario, where the information that they're giving you is subjective, in other words, cannot be measured, you don't really have a lot of information about what's really going on. Everything they're giving you is subjective, presumptions. You probably need to validate and do an assessment that gives you objective data before you give the medication. Now, there are rules of exceptions. For example, an emergency. They're telling you that this is an emergency, your patient is not breathing, your patient is having an allergic reaction to a medication. There is no time to do another assessment. You have to intervene. Stop that blood transfusion. Stop that antibiotic. Give XYZ emergency drug. So that is a rule or the exception. But for the most, if you're dealing with a scenario, a pharmacology scenario, that they are not providing a whole lot of information, that is really an assessment versus implementation scenario. What I want you to really understand is that many pharmacology questions is not really about pharmacology knowledge. It's about safety. So don't make the assumption that because they mention a medication on the stem of the question and you don't recognize that medication, that you're lost. And this is what students do. They see a medication, XYZ medication, and they go, oh, I don't know that. Metronidazole. What's that? I haven't studied that medication. And you give up. Keep reading. The answer could be as simple as check the patient's ID band and make sure you got the right patient. Well, I don't really need to know what the action, the mechanism of action of metronidazole is to select that my first intervention is to check if the patient is the right patient. Because that is a medication safety style question. But most times, when a student sees a pharmacology medication that they don't recognize, they start giving up. And this is something that you need to correct. You need to fix right away. Never give up. Read the whole question. Read all the answers. Read all the answers. And then make a decision. So I really want you to focus on this. An example says, a patient complains of itching and the nurse validates this subjective finding when observing for scratch marks and a rash. In other words, what this example is giving you, that a patient could say, hey, nurse, is itching. You cannot automatically assume that the patient is having an anaphylactic reaction. You have to assess the patient. You have to really identify what is the extent of the itching. When did the itching appear? You have to validate to see what is the problem. However, if they're telling you, a patient, you gave a, let's say, an antibiotic to the patient for the first time, and now the patient has difficulty breathing. Oh, we have a different scenario now. Because now we have airway being affected. In those scenarios, then you might not have the time to validate with another assessment, and you may have to intervene because you're dealing with a medical emergency.